Hi everybody, I'm Mark and this is Ryan with the Innovative Agent. This is a first of a two-part video series, possibly three, on the Surgery Center of Oklahoma. These videos on the Surgery Center of Oklahoma might be the most important videos we will ever do as an organization. The reason why I say that is what we all know. The healthcare system's broken. There's no promise of it being fixed anytime in the near future. And premiums keep going up and healthcare costs keep going up. And for everybody, we're all in the same boat. If you want to defer some of the increases, you have to go to larger out-of-pocket costs, which means eventually when the day comes when you need it, you're going to pay a big price.
Yeah, it leaves you open to all of those costs when you have those high deductible plans, high out-of-pocket cost plans, and you're still paying quite a bit on the premium as well. So you're setting yourself up for disaster.
Right. So what does the Surgery Center of Oklahoma have to do with this? Well, that surgery center is a unique center that's driven off of American capitalism concepts.
The more especially the free market enterprise concept that they've taken allows them to remain competitive, but also save you money because they know where the price breaks are.
Right. Just like any other business competing in the market today, you have to deliver lowest cost that you possibly can while providing the highest quality for whatever service or product you're providing. And that's what they do and do really well. And there's something special about this. And that is that they're not involved in the health insurance realm. If you go to their website, the Surgical Center of Oklahoma's website, you will find there where you have full price transparency. For every surgery that they do, it's priced online. That's your bottom line price, period. And it is astounding. It's unbelievable to see the low prices they have for their surgeries as compared to other places. Their model is picking up steam, and we are certain that we're going to see more and more facilities around the United States jumping in and saying, you know what, enough with this broken healthcare system. We're just going to provide great service, great quality, do great surgeries like SCO, and give Americans relief. And we're talking significant relief when you do your comparison shopping for surgeries.
Yeah, it really trims the fat from your typical surgery, allows you to be a consumer. For example, I need my knee repaired at some point, so out of curiosity, I just looked. And just for the scope that I would need to clean that up, it's $24,000 locally, whereas there it's between 15 and 17, depending on which. So just the savings alone make the trip worth it in that scenario. Absolutely.
And it's not that they're new at doing this. They've been doing these surgeries now for well over 5 years, and their first customers are actually Canadians that's in a broken healthcare system, a nationalized healthcare system, and Canadians were the first flying in saying, I'll take that. And now people that are shopping for health insurance or surgeries, I should say, doing the medical tourism, going to other countries, they're taking a second look and they're saying, hold on a second here. That awesome surgery I could have done in China or some of these other countries, I can have done at the same cost or lower at the Surgery Center of Oklahoma. This is how significant this really is.
Well, just recently I got an email for a product, because we're in the insurance industry, a product designed specifically for the Puerto Rico medical tourism. It was the craziest thing ever, because you think of it as a part of America because they are, body of America, but it's so different there the way they operate that similar to the Surgery Center of Oklahoma, you're going to see savings just by showing up. to the point where you can actually travel and have some fun while you're doing it.
Absolutely. And we're going to help through these videos to let you, as either the consumer or the insurance agent, really get a better understanding of who they are. But don't just look at our video. Go to the media page at their website. They've been interviewed by a lot of organizations, from Fox to, I believe, CNN, just a number of different outlets. And they're all saying the same thing as we are. This is truly amazing, and it's just going to get better and better because there's an association that's been formed as a result of this that's going to help spread this type of low-cost surgery out across America. And let me give you an example. I have a surgery that I have to have 3 days from now. Now, this is an umbilical hernia surgery that I need to have. And in layman terms, that means I've got a hernia in the belly button. And I shopped them out. And what did I find? Well, for a low-cost surgery, and it really is, this is not a major surgery. It's nothing like your knee. What, you said $24,000 here locally.
It's not going to be fun when that day comes.
Yeah, exactly. I shopped out my hernia operation, and what we're going to do, we're going to bring up the cost comparison and take a look at this. So we looked at this 3 different ways. First of all, I did a quote for this surgery locally, and you can see the surgeon, facility, and anesthesiologist costs for a total out the door cost of $5,700. I shopped it out against the Healthcare Blue Book, which is an awesome resource for everybody. If you as an agent or you as a consumer are not using it, you definitely want to do that, because the Healthcare Blue Book gives you the fair price estimate of all surgeries. In this case, they said this hernia surgery should cost me $4,800. The Oklahoma Surgery Center, $3,100 out the door. So the total savings by going to have this simple operation done at the Oklahoma Surgery Center, the savings is $2,557. Now, I have travel and lodging expenses, obviously, so that might eat $1,000, maybe $1,500 on it, but I can put that in my pocket. Remember, we started out this discussion about where Americans have gone with their health care, and that is to very high deductible and very high out-of-pocket plans. So you're writing that check first dollar with most of these, and it's going to get worse. So as I'm looking at this thinking, really, should I go from northern Michigan to Oklahoma City? Should I really do this? And I thought, what a great way to tie in who this organization really is and say, you know what, I'm going to live by example. I'm not just going to talk about it, I'm going to live it. And certainly sitting down and writing a check for $3,190 is a lot more palatable to me than $5,747. Now, I don't make the big money you do, Ryan, but to me, that's a lot of money. So we're excited about that. We have our next video will be at SCO, and that will be an interview I will be doing with one of the co-founders, Keith Smith, and you do not want to miss this video. It's going to be probably entertaining, very informative, and I'm hoping to dissect a lot of issues, questions.
Really get some insight on how this concept works for not only them, but also the consumer. So.
Yep, absolutely. So we're looking forward to seeing you at that next interview. Then right behind that, I will have my surgery, and hopefully we'll have some pictures, certainly not during the surgery or anything, but maybe some pictures of the facility that we can share with you as well and put on our website. So that's it for now, and we look forward to our next video in Oklahoma City.